Now going to take a look at the structures of the female reproductive system. We are looking here at a kind of a lateral view of the female reproductive system. To be able to see the structures better, I'm going to remove the outside of the model here. Kind of what we're looking at is this would be here the vaginal canal. This is the uterus. This is the urinary bladder. This is the anus and the rectum. This area here would be the opening to the female urinary tract, the skin folds, and the erectile tissue at the anterior, sitting just below the pubic bone. So let's go ahead and remove this outer part of the model. So we're going to first identify the body of the uterus. So this organ right here is the uterus, and the body of the uterus, kind of like the body of the stomach, is the major portion of the uterus. The fundus of the uterus is this kind of flexed, anteverted, or anterior lying portion of the uterus. So this would be the fundus. This would be the body of the uterus, and kind of the most inferior piece to the uterus is the cervix. So cervix, body, fundus. The opening here is the lumen of the uterus, and the lumen of the uterus inferiorly at the cervix is going to be continuous with the vaginal canal. Let's next identify the ovary. So I'm going to just go ahead and tip the model here so we can see the ovary. Now we're only looking at kind of one side of this model, so we're only going to see one ovary. We see the ovary here, and the ovary sits in close proximity to this tube here, which is the fallopian or the uterine tube. This is the tube that is going to receive an ovulated egg cell. The fimbriae, as we move through this tube and we get closer to the ovary, we can see that this tube expands into these finger-like appendages, which are called fimbriae. The next structure to identify is the labia majora and then the labia minora. To see these, we're going to move more inferiorly on the model. These are both skin-like folds that just sit exterior to the opening of the vaginal canal. This structure here on the model is going to be the labia majora, and this the labia minora. The next structure to identify is the clitoris. Here we see the clitoris in this model right here. It's an structure that is made of erectile tissue and stiffens during sexual arousal. The next two structures to identify are ligaments, the round ligament, the broad ligament, and we've got one more ligament called the ovarian ligament. So again, to see these structures, I'm going to need to tip the model. This ligament that we see here is known as the round ligament. The broad ligament is, as the name implies, it's very broad. Okay, so here we see the broad ligament. And then the ovarian ligament is this ligament here. So we have the round ligament, we have the broad ligament, and we have the ovarian ligament. The next structure to identify is the urethra. So the urethra is the tube that carries urine out of the body from the urinary bladder. This is the urinary bladder here. Within the urinary bladder is where we're going to be storing our urine that was produced in the nephrons up in the kidney. And the urethra we see here. The rectum in this model we see here, so this is the rectum. Urinary bladder I've already drawn attention to. What I want to do is I want to show you the ureter in its more distal position. You saw the ureter when we went through the urinary system model, but I want to show it to you here on this reproductive model. So this tube right here terminates at the urinary bladder, so just the posterior aspect of the urinary bladder, this tube is going to terminate, and this is our ureter. The vagina or the vaginal canal, again we see here, as I mentioned, that vaginal canal at its kind of superior location is going to be continuous with the distal portion of the ureter, which is the cervix. So this is the vagina or the vaginal canal. The endometrium, the myometrium, and the perimetrium are the three layers of the uterus. The endometrium is going to be the deepest of the three layers. So again, we're identifying the uterus. The deepest of the three layers, just external to the lumen of the uterus, is going to be the endometrium. The largest, thickest layer of the three is the myometrium. This is the middle or the muscular layer. So I'm touching the myometrium here with the probe. And then finally, the perimetrium is a connective tissue superficial layer that surrounds the other two. The lumen of the uterus I've already drawn attention to. So this is the space here that exists at the central part of the organ.